Case 6: Secondary Analysis and Descriptive Epidemiology of Asthma. Vijay's Asthma, featuring Mercy Abolu as the pediatrician, Galia Bigman as Vijay's mother, Lindsay Dickey, production director, Vijay Salvaraj as Vijay. The scenario is in a pediatrician's office. Vijay is here for his 2 o'clock appointment. Dr. Abulu is busy reviewing Vijay's records and asks Vijay to be sent in. Hi, Dr. Abulu.
Hi Vijay, you're looking good. You've grown since I've seen you last. Well, no wonder it's been about a year since your last appointment. You came in around your 12th birthday last time. How is your mother?
Good. She's in the waiting room. She's due in 2 weeks.
Oh, glad to hear it. Well, it looks like you're here for your yearly checkup appointment after we prescribed you the albuterol inhaler. By the way, how is that working out for you?
Good. I can breathe much easier now. I use it only when I get an attack, which is rare nowadays.
I'm glad to hear it. Some people find that steroids give them rashes and acne and causes them to gain weight. We usually treat asthma on a patient by patient basis, and different patients have different treatment needs. When did you last experience shortness of breath requiring your inhaler, Vijay?
Hmm, maybe when we visited my aunt's house over Christmas?
Ah, that is about 3 months then. When you do have an attack, mm, have you noticed any triggers?
Well, actually, I think it may have something to do with dust because my aunt had just had her house renovation started.
Well, is a common trigger for asthma, Vijay. Kids your age are commonly exposed to allergens such as pet dander, tree, and grass pollens. You wouldn't believe it, but even stress can be a trigger factor for an asthma attack.
Oh, wow. Luckily, I haven't had any attacks brought on by stress because I have a huge test at the end of the week.
You are lucky. There are two broad categories of asthma: intrinsic and extrinsic. The stress kind is of the intrinsic variety, and since there are no external triggers to avoid, it is a harder type of asthma to manage than the type you have. The extrinsic trigger is more common among children, and if you're lucky, you will grow out of it. By the time you're in high school, you'll be symptom free. Have you noticed a decreasing frequency of attacks recently?
Actually, yes.
Oh, that's great news, Vijay. We have to keep monitoring it until we can declare you symptom free. But you have to come in for your regular checkups to make sure everything is under control, okay? Well, Vijay, you can go and get your mother now. I'd really love to speak to her for a bit.
Hi, Dr. Abulu.
Hi, Mrs. Bigman. How is the pregnancy going?
Very good, doctor. But I'm worried that my baby will have asthma too. What do you think I can do to make sure he or she is healthy?
Oh, Mrs. Bigman. Well, first of all, asthma does not preclude an individual from living a long and healthy life. So far as it is diagnosed and managed, individuals with asthma can live full and healthy lives. Very few individuals with asthma suffer from severe or hard to manage asthma. Usually, individuals with asthma are able to avoid their triggers or take medication that can reduce the risk of attacks and end them quickly when it happens. As far as how to prevent it, you probably know asthma has a very complex set of risk factors. Children from certain races, such as blacks and ethnic Native Americans and Hawaiians, are more likely to have asthma. Boys, too, for some reason, have a higher rate of asthma prevalence than girls, but the gender gap equals out by adulthood. Adult women even have a higher prevalence of asthma than adult men. Well, so again, Mrs. Bigman, some risk factors are maternal stress. So try to relax and do not be too relaxed and let your house get dirty because dust and mites are allergens and common triggers for your son's asthma. And make sure you limit your exposure to smoke and corticosteroids because these exposures while your baby is in utero can actually increase the baby's chances of having asthma. So keep yourself and the baby healthy because this is important as preterm birth and infections, particularly respiratory infections in infants, are believed to be associated with childhood asthma. Luckily, there doesn't seem to be a strong component of genetics in asthma. So just because Vijay has asthma doesn't mean your baby will have it too.
Um, how long after my baby's birth will I have to wait until we know if my baby has asthma?
Oh, asthma is a chronic inflammation of the upper respiratory tract. It is hard to diagnose asthma in infants since their lungs are still developing and susceptible to a host of other problems. In babies, other respiratory conditions can cause the common asthma symptom of wheeze. So we usually wait until a child is at least 1 year old or older before we attempt to diagnose asthma.
I guess we'll just have to wait and see. I was talking with Vijay's middle school nurse earlier in the year about where he keeps his inhaler, and she said that almost 1 in 5 students had had asthma as a child. 1 in 5! I never realized how common asthma was.
It is so true, Mrs. Big Man, especially here in Georgia. We, for some reason, have an above average prevalence of asthma in the deep south compared with the national average. But it is also true that only about half of children who have asthma in childhood will still suffer with shortness of breath and attacks in high school. Vijay, in fact, actually seems to be experiencing his asthma symptoms less and less.
Oh, that would be great news. One less thing to worry about. Is this asthma problem getting bigger? I mean, has there always been this many kids with asthma? I didn't know any kids with asthma in my neighborhood when I was growing up.
Yeah, no, you're right. It seems that asthma, and particularly youth asthma, has been on the rise for decades. Obesity in late childhood is a factor associated with getting asthma. So that's one possible reason. Another is preterm babies have better survival rates now. And populations across the globe in different climates and environmental conditions are also experiencing climbing asthma levels. Experts are not even sure why.
Well, I'll just keep my fingers crossed and my indoor allergen level as low as possible. Thanks, doctor.
Oh, thanks, Miss Bigman, for coming in, and good luck with the pregnancy.
Bye.
Bye.